At our clinic, we perform a lot of implant removal surgeries. Most commonly, we remove nasal silicone implants, but we also perform removal surgeries for nasolabial, paranasal chin and forehead implants. This time we had a particularly unique and special case, so I prepared this video to share that experience with you. This patient is a male, and interestingly, he had a star-shaped silicone implant inserted into the back of his hand. After administering anesthesia, the star shape appeared somewhat blurred, and on the back of his hand near the pinky finger there was a scar about 1 to 2 centimeters long from a previous incision, which was quite visible. It seemed that he had undergone a procedure where the area under the skin was dissected, and a star-shaped silicone implant with a hole in the center was inserted. In fact, this was a case where the star shape was made to stand out quite prominently on the back of the hand through an implant procedure. We considered how to remove the implant. In fact, there are two main things that are important. This isn't just a case for implants on the back of the hand. No matter the case, when you remove it, you have to make an incision. The issue is where to place that scar and how to make it as unnoticeable as possible. Next, of course, it's very important to make sure there are no side effects or complications after the removal surgery. Lastly, it's important to ensure that the shape is well maintained after the surgery is finished. First of all, this star-shaped silicone actually has a hole in the center, so while inserting it might be a bit easier, removing it is not that simple. That's because when inserting it, you can just dissect the whole area and place it in, but in the meantime, the skin in the empty space in the center ends up sticking to both the top and the bottom surfaces. There are basically two main ways to remove this. One is to dissect the entire area, just like when it was inserted, and take it out that way. The other is, since the center is hollow and shaped like a string, you can cut the middle and pull it out piece by piece. But with the first method, where you dissect the entire area to remove it, the incision line can end up being quite long, and since the area of dissection is larger, it can be functionally risky. Also, the recovery period may take longer. So we considered the second method, which is to minimize the incision and remove the silicone implant through that small opening. We decided to use the same 1 centimeter incision that was previously made, without making it any longer. In fact, since the scar from before wasn't very good, we planned the surgery in a way that would actually improve that scar. As you can see, the incision has already been made, and it's like grabbing the silicone here and pulling it out. You can't just recklessly say, "Thank you" here. You shouldn't just pull it out like that. Because there can be a lot of tissue damage, we very carefully removed part of it, then cut it into sections and took it out little by little. We removed the silicone by taking it out little by little, minimizing tissue damage as much as possible. On the back of the hand, there are muscles and tendons that lift the fingers upward. If these are damaged, the muscles that raise the fingers can be affected, leading to functional problems. If that happens, it becomes a serious problem, and if the tendon is severed, we would have to make a vertical incision on the back of the hand to reconnect the tendon. That's why we proceeded with the surgery extremely carefully. Here is a photo showing the silicone, shaped like a star, placed back in its original position after being cleanly and neatly removed. As you can see, there is an incision about 1 centimeter long, and you can see that it has been neatly and cleanly sutured. This is how it looked a little over a week later. There is a bit of bruising, but thank you. The wound has healed well, the swelling has gone down significantly, and the star-shaped stretched skin has adhered nicely, so you can hardly see any trace of it now. Some people may have silicone in special areas, or more commonly in places like the nose, chin, or nasolabial fold, where silicone is often inserted. If you experience discomfort or side effects in these areas, you may want to have the silicone removed. For those people, I recommend that you take these factors into consideration and choose a hospital that can perform the procedure as delicately and skillfully as possible.